Ese ano corre como como I see that. Okay. Hi, everyone. I am Tara, aka Spirit Mother, and I would like to welcome you all back to YouTube. Spirit Teaches Going with Itself, on TikTok 1974 Enlightened Soul, and I'm also live on my Facebook. If you're new to my channel, I always recommend, suggest, and I really encourage you to read the description of my YouTube channel, Spirit to Spirit Teaches Going with Itself, to get a better understanding of what it is that I bring forward on my channel. As some of you know, I use my own life experiences and I bring them forward. And it can go with the medical system, the educational system, the justice system, just wherever it goes and wherever spirit takes me. And so today I'm diving into the medical system, okay, and different parts of it, and it's the dentist right now. We're going to go and touch base on the dentist because last week on the 25th, I was to the dentist. Okay, and it was really weird when I went in there. Like I filled out the paperwork and I went to the dentist and I went in and, hey, I was sitting there and she put the bib on me and she said, because I was going in to get a cavity filled. And I knew that there had been a filling there before, but it didn't come out right. And I knew that I had a really bad cavity there. So, we weren't telling me anything. No. So when I went in, they did the X-ray. Okay, they put that little thing in your mouth that clenched down on it. And I mean, my mouth was hurting. I knew I had it. I knew that it was infected. Also, because that's why I wanted in so quickly. So when I was sitting there, they had done the X-ray, and he come in and he told me, well, you have a really bad cavity and what have you, and said not putting a filling in it, like, we'll give you a root canal or we'll pull the tube. But it was infected right down to the roots, into the nerves, okay? And it was, when I understood it, it's abscess, which, because to try and bite down, it hurts, and it goes all through my jaw and into my ear and sometimes up into here. And I've been like doing a lot of cold sweats at night. Okay, some would say, well, maybe we should go to the hospital for that. Well, I know that there's other people in worse shape than I am, So when I was like, he gave me a prescription, which I found really odd, okay? Because it was a prescription that, the first day you take 2 pills, like 500 milligrams, each pill being 250 milligrams. So you take 2 pills the first day, okay? Because apparently I don't know the severity of my allergy to penicillin, but, I knew like a young child I had an allergy to penicillin, whether it was just a rash or what. So I ended up looking it up today, okay? And it was like 1 pill, like 2 pills for the first day, just 2 pills at once, so 500 milligrams, and then 1 200 milligram pill for the next 4 days, which, okay, that's 1,500 milligrams, right? It's 250 one day, and then the 4 days, well, that's 505, like, it's 1,500 milligrams. For an antibiotic for a really bad abscess that he said was down into the nerves of the tooth, down right into the roots. Okay. That's why, like, when I did the introduction, like prior to coming in, I said, question. question things, okay? Because you really need to. If you don't start questioning things, you could actually be causing yourself some harm. Because sometimes it all comes to the almighty dollar, okay? Because I was going in for a filling, and he told me you had like there's one of two choices: you get a root canal, or you get the tooth pulled. So I looked into that, and when he said about like we can pull the tooth today, I was just like laying in the chair. No, his spirit told me, nope, something not right. Get the fuck out of the chair and leave that office. So when I was leaving the office, we went up to the front desk, and she printed off whatever it was that she printed off, the receipt or what have you. But she didn't give me a receipt. She took the receipt and she set it on the desk. I didn't get charged for anything. My dental plan only covers, I think it might be 70%. It's on, like, I'm through community services, but still, like, you usually get charged at 70. The other remaining 30 or 20%, right? But it cost me nothing. And I didn't get a receipt regarding the appointment. Okay. So, today the spirit had me questioning things because I knew, that day that, if you have an abscess or an infection in the tooth, you don't pull the tooth and you don't do a root canal. But he was going to pull the tooth that day without getting rid of the infection, which made sense to me because I had a filling back here. And he even told me if you pulled this tooth, you get partial. That a partial wouldn't work, but I Googled it and a partial would. But I wasn't getting the tooth pulled because over on this side, a few years ago, I went to the dentist because I had a cavity. I knew I needed filling, and the tooth was half broke off. And they told me that they're not giving a root canal and they're not pulling the tooth because the nerves in the tooth you still feel. They still had feeling to them, right? So I was looking, and like right now to try and bite down on that tooth, it hurts. Like it pushes, so it's all pushing together. So it's infected and it's going through. Okay, okay. So I Googled, should you pull a tooth that is infected? No, you should not pull a tooth, that is abscessed. No, you should not. Oh, and they told me as long as because the nerve was working, so they were just putting in filling in over here. That was 3 years ago. As long as the nerve is working, you don't root canal it, you don't pull it, you just fill it. So, no, you should not pull a tooth that is abscessed into the nerves itself, which mine is. Nerves yourself. This requires yourself. That was not what I was asking, but this requires a dentist because an abscessed tooth is a serious infection that can spread to other parts of the body, which it's like I even thought that, that I had to get my ears cleaned because it's going right in here. Like I know this has been like this for a while because it goes down and all through my jaw and down into my lymph nodes. Okay. And I've been playing. First, I thought it was like, my bedclothes and what have you, but making me sweat, but it wasn't. So the parts of the body, if not treated professionally, A dentist will properly drain the infection, which he did not. All he did was take and use his finger. He didn't drain it. He didn't do anything to it. He just said, hey, well, we'll give you a root canal or we'll pull your tooth. Where exactly did you get your dental license? From the Cracker Jack box? I thought they stopped giving those away a long time ago. This is a spirit of despair, and those spirits know exactly who I'm talking to. Don't take people, you're not fucking idiots, but they treat you like you are because they don't want you to question anything. My channel's not for everyone. I'll make you laugh. I'll make you cry. I'll piss you off. You want to punch me upside my head. And, hey, you want a battle? Bring it energetically. You'll even love me, hate me, like me, loathe me. Sometimes all of the above at the same fucking time. Let's go. Drain the infection, assess the surrounding structure, and determine if the tooth can be saved with a root canal or if it must be extracted. Attempting to pull it yourself can lead to severe bleeding, uncontrollable infection, and life-threatening complications. Well, a lot of common sense tells you that. When we were kids, we used to pull our own teeth because, we wanted the tooth fairy to come. Look. Ouch. It hurts. Okay, so dangers of DIY extraction. Spread of infection. An untreated infection can spread to your jaw, neck, and even bloodstream, leading to life-threatening condition called sepsis. Severe bleeding. The infection can affect blood vessels, and improper extraction can cause uncontrolled bleeding. Okay, now, back in 99, when I had this tooth back here removed, it was infected. It was the same thing. It was an abscess, and he pulled it. He didn't take the pus out, and he didn't give me antibiotics or anything like that. And this was a dentist from the hospital. So what ended up happening is I had bleeding, but I ended up getting a blister on top of it, and it was there for quite some time. Where at times it almost felt like a bone, and I kept trying to bust it, so the infection was going through my body. That's what happens. Okay, that's why people get the stuff in the mouth, because dentists don't listen. They don't give you the antibiotics to get rid of the infection before they decide to do any work on your teeth. That's why infection builds up. But what do I know, right? I'm not a dentist. I don't have a certificate. Well, I question where you got yours. Excuse me. Okay, severe bleeding, control. Incomplete extraction, which maybe that's what that was. Who knows? You may leave pieces of the infected tooth or abscess behind, which will allow the infection to continue. But yet he was going to pull this tooth out. Or he was going to give a root canal. Root canals are supposed to be very, a root canal can cause complications for the person, even afterwards, with regards to different parts of your body. But they don't tell you that. But there's a documentary about it. Damage to surrounding structure. The infection and the attempt to pull the tooth can damage nerves and other nearby structures. So he told me that the nerve, down to the nerve, or right around the nerve, it was all full of infection. So that's just like an abscess. You have to clear that up first before you fucking do anything else. Because, that's why, like, my gums burn. It's the infection. Okay. And that's what's happening with a lot of people. It's more likely that you have an infection that's causing a lot of the decay and a lot of your pain and suffering. They don't clear up the infection because, 5 days of pills and only 1,500 milligrams of an antibiotic is going to create a super. We'll get to that in a minute. Damage to sweat. Okay, the infection and the structure. Okay, professional treatment options: drainage and cleaning. The first step is for a dentist to drain the pus and clean the infected area. If he didn't do that, he didn't drain it, he didn't clean it, he did nothing but, do an x-ray and stick his finger here. Like I said, I thought they stopped giving, these licenses in the Cracker Jack boxes a long time ago. Root canal, if the tooth can be saved, a root canal will remove the infected pulp, disinfect the canals, and be sealed to save the tooth. Okay, but clean the tooth, clean up the pus. A filling would do just great because they killed half a fucking tooth. And it's been there for 3 years now. And that was half a tooth, so it was really fucking decayed. But because the nerve is still working, they don't want to remove the tooth. But they didn't give antibiotics then either, which that was the first thing they should have done right after filling the tooth. Because I believe that there's still like an infection up in there because it affects this side of my jaw too. Extraction. If the infection is too advanced or the tooth cannot be saved, the dentist or oral surgeon will perform the extraction safely. Antibiotics. The dentist may also prescribe antibiotics to help clear the infection. To me, 5 days, 1,500 milligrams of an antibiotic ain't going to do fucking shit. And it didn't. When to seek immediate emergency care. Go to the emergency room immediately if you have an abscessed tooth and experience any of these symptoms, as they could indicate a systematic infection. Okay, yeah, I believe that because I believe that, that's a big part of what is going on with me. I need the infection cleared up because it's going throughout my body. Because I thought, I need to go get the wax cleared out of my ears because it hurts so much. And sometimes I have to go like that to stick my finger in and kind of put pressure. Because I find sometimes pressure on pressure helps to relieve pressure, which, sounds a little fucked up, but it's true. So, difficulty breathing. Okay, at points I have that off and on. Okay. High fever. Well, I don't know if I have a high fever, but sometimes I feel like I'm boiling. But to touch my skin, A lot of time it doesn't feel like it. Dramatic swelling. Well, it feels like there's like swelling over here and kind of in the lymph nodes, but a lot of the time it's that my gums feel like they're on fire and they feel like they're like thinning out. Difficulty opening your mouth. I do. Sometimes, like, I have the difficulty opening my mouth, but most of the time I have difficulty trying to eat something because it hurts not only in the teeth, but it hurts the whole freaking jaw. Signs of sepsis, such as confusion, increased heartbeat, cold, clammy skin, which, I get a lot of that. And I'm always saying, holy shit, like I'm hot, but I'm cold. It's like I'm hot and then I'm cold and then I'm hot and then I'm cold. People say that's menopause. No, it's not menopause. It's called infection. Because, I even thought maybe it's the sheets I have on my bed because I had one of those cover mattress things to protect your bed. So I took that off, but I still have it. And I wake up and I'm like cold, but I'm sweating. Sometimes to the point where, I do have to change. And it's just all throughout the day. Or dizziness. Sometimes it's like, holy shit, whoa. Should I go to the hospital? Maybe, but I have an appointment next week, which I'm confused about that because I had to wait until the 30th of December to get in to get a filling. But they have an appointment. I go next week, and they're gonna look into the abscess and do what you got to do. Okay. So then I went in and asked, do you get a root canal when the nerves are dead? Okay, because their nerves are going quite well. Like they're working over fucking time right now. Okay. So the nerves are working well. And like I said, when the dentist did this filling, they said that they weren't doing a root canal and they weren't pulling it because the nerves were still working. It's when they die. So, do you get a root canal when the nerves are dead? Yes. You get a root canal when the nerves are dead because a root canal removes the dead nerves and infected tissue to save the tooth from extraction. A tooth's nerve can die from deep cavities, trauma, or cracks. And even though the nerve is dead, the infection can spread to the jawbone and cause further problems. The root canal procedure involves cleaning out the pulp and nerve, disinfecting the inside of the tooth, and sealing it to save it. So, do that and, it's doing it. He didn't drain it. He gave me 500 milligrams of an antibiotic. And I'm going to get to that in a minute with regards to that because I looked into it. So the best antibiotics for this. Why a root canal is needed for a dead nerve. Same dead nerves. Maybe people are getting root canals that actually don't need them and the nerves are still firing. They're still working. And maybe that's why you get pains throughout other parts of your body. Not getting rid of the infection first. They're not draining the abscess. They're just going in and doing it. So I'll ask you again. Well, I'll say I thought they stopped giving out licenses of any kind in the Cracker Jack boxes a long fucking time ago. Infection. A dead nerve indicates the inner tissue of the tooth is dead. Mine's not. I don't fucking feel it quite well. Like, even to try to bite down is like, holy shit, man. Can I ever feel it? Like, not just on the tooth, but like right up in the fucking jawbone. So the nerves ain't dead. But he wanted to give me a root canal or pull my fucking tooth. Disincollected. All this. Because many people don't want to go around missing teeth. So that's where they make money off bridges, partials, and implants. Max hasn't had his teeth pulled because his the nerves in his teeth were actually like fucking dead. I seen his teeth, and my goodness, they were like, yeah, it's something you'd almost throw up. But for 10 years, he was going to a dentist, and they said, "Oh, just come back every 3 months and get your teeth cleaned." Meanwhile, he was full of fucking infection. A dead nerve indicates that the inner tissue of the tooth is dead. The inner tissue of my tooth is not dead. But bacteria can still be present and cause an infection that spreads to surrounding bones. Saving the tooth. The root canal is performed to remove the infection and dead tissue, saving the tooth from being pulled or extracted. But what's the chances? Because to have a root canal is very fucking expensive. And a filling is a lot cheaper. I understand if it's dead, maybe then. Saving the tooth. The root canal is performed to remove the infection. Oh, I read that. Preventing future issues. Untreated dead or dying teeth can lead to more serious problems like abscess, and extraction can cause other teeth to shift out of place. See, what's going on here is I can feel like my tooth because it swells up. So when it swells up, when everything swells up, it pushes against each other. So it makes it even more painful, but it's not about pulling the tooth. It's not about getting the root canal. It's about getting rid of the fucking infection that's been there for a very long time. And it probably is going through my body because, like I said, I feel it in the ear, I feel it down into the lymph nodes, and like sometimes it's like I feel up here and what have you. And I'm not I don't like medication, but I do know when something like that is required, especially if you don't have access to what is a natural antibiotic or somebody who knows about it, because that is the first thing they should be going to, but they don't. So, you know, it's like, shh. Okay. So I ended up Googling what are the best antibiotics for a tooth infection, which, like I said, it's all going through here. There are several. Kill the common mouth bacteria that cause tooth infection. The best first-line antibiotics for tooth infection include amoxicillin, penicillin, cetirizine, okay, Cililinate, dimethicillin and isomethylmethicillin. Just 1 second. This was my antibiotic. 200 milligrams, 0 refills. Take 2 tablets once daily on day 1. So take first 2 tablets. They told me to take them right away, both at the same time. And then take 1 tablet once daily on days 2 to 5. That's what I got. For what he said was an extremely infected tooth to the point where it needed a root canal or to be pulled. Please, does that make sense? And why are we not questioning them more often than not? Because see, the thing is, if you can do like something that will keep them having to come back, because you get more infection, and that's more money for pharmaceuticals, or if you go to the doctor and what have you, instead of doing it right the first time. Because hey, you're supposed to know what you're doing. And I know that not all doctors are the same. That there are some that really do know what they're doing, because my ex-husband's surgeon who did surgery on the last, he fucking knew what he was doing. And he even said, for like a doctor would make you wait. Oh, well, it's not big enough. But this surgeon said that you catch it when it's small, not leave it till it becomes more of a problem, because that's where you run into complications. So who's stupid for that? The doctor who keeps making you prolong it. And he actually had a different surgeon tell him, oh, well, no, it's like, you can go. But this surgeon that actually did the surgery, he said, no, you get it done early. You don't leave it. The best antibiotics for tooth infection, okay? So, okay, this is the American Dental Association recommendation. I'm allergic to penicillin. Like I said, I don't know, like, whether it's a small one or a big one. Okay? Oral amoxicillin. If you are allergic to penicillin, get this: 500 milligrams 3 times a day. For 3 to 7 days. 1, 2, 3. This is 1 day, according to amoxicillin. And he gave this to me for 5 days. And you call yourself a doctor? You're quack. So 500 milligrams 3 times a day for 3 to 7 days, but he gave me 1,500 milligrams, which, according to that, is 1 day. But I was given it for over 5 days. We'll get to that. Oral penicillin, a second option. this 500 milligrams 4 times a day. 4 times a day. Okay, so it's this package plus another two, because each one of these is 250 milligrams. Do the math. So 4 times a day for 3 to 7 days. But this was 5 days. No wonder the infection ain't fucking gone. It just could create a superbug. Okay, so that's, amoxicillin and penicillin. The first one, 500 milligrams 3 times a day for 3 to 7 days. Penicillin, 500 milligrams 4 times a day for 3 to 7 days. And that was 5 days. And for the amoxicillin, that's 1 day. If you have a history of severe allergy, symptoms of hives, swelling, or drop in blood pressure through penicillin, ampicillin, or amoxicillin, that the ADHD recommends. Oral, and it's spelled AZITHROMYCIN, which is this right here. This is the odd man out. Keep listening, because I said it's the odd man out. Loading dose, 500 milligrams on day 1. So 2 of those on day 1. And followed by 250 milligrams for the additional 4 days. 1, 2, 3, 4. So, like I said, something for 5 days. For amoxicillin, that's 1 day of pills. And then you have to add for penicillin, that's another 2 pills for 1 day. Okay, so you have those 3. The others were 500 milligrams 3 or 4 times a day. But this one is, 500 milligrams the first day and 250 milligrams the day after. So I will say it again. 1 day of amoxicillin is 5 days of this. Then we go on to oral slindamycin. SLINDAMYCIN. Well, this one here is 300 milligrams. So 1 1/2 of pills. But that itself, too, is 4 times a day for 3 to 7 days. Just 1 sec. Okay. Now we'll go down. If you have a history of mild allergy to penicillin, or amoxicillin, the FDA recommends oral cephalinicin. CEPHALEXIN. And even that is 500 milligrams. So 2 of these, 4 times 6. So another one, like this here is the same thing. 1 of these plus 2 more pills a day. And this was for 5 days. Other antibiotics may be used. If first-line antibiotics are not working, they include amoxicillin with glyphosate and cortisone. Antibiotics for tooth abscess complications, which, I guess that's what I. A deep neck infection is dangerous. Complications of tooth infection when it spreads into the space between neck muscles. An abscess forms inside the neck. The abscess may swell and block breathing or swelling. Deep neck infections are treated in the hospital with an intravenous antibiotic along with opening the space in the neck to drain the abscess. And it gets in there, and sometimes, like, I gotta take, and I grab hold of this, and I try, like, I squeeze it to put pressure because it hurts so damn bad. With opening the space in the neck to drain the abscess. For this type of infection, the best antibiotic may be amoxicillin with fluoride through an IV. So, a root canal and a tooth abstract should not be performed until the infection is cleared up. But he was ready to pull my tooth that day. And he thought that I was afraid of having a tooth pulled. Because he talked to me like a little child. Oh, well, it's not going to hurt. It's in the very back. And there's very little tissue in that there. So it's not going to hurt. It's like, you dumbass. I wasn't worried about whether it would fucking hurt or not. I was concerned that you were jumping the gun and, hey, you weren't doing your fucking job properly. Share your experiences with regards to this stuff. I'm serious. Like, share your experiences, because even I've had experiences with the doctor where the doctor told me wrong, but come to find out I was actually the one that was right. But anytime I tried questioning, they get irritated with me. You're supposed to ask your doctor questions, are you not? So you can fucking understand. But they never want you doing that work. Where was I? It was the same thing somebody had said that when you go in there and for walking, they take people, like, people who go into the walking clinic, and this was people that would refer someone to a walking clinic. You go into the walking clinic, you're in there long enough for them to write you a prescription. How exactly is that really being a doctor? If I knew what medication was for what, I could sit there all day and do this. Oh, these are your symptoms. Okay, just 1 second. I'll get my prescription pad. Let's see. Oh, better use one pen. Okay, I want you to. I'll give you amoxicillin. They don't even tell you. He didn't even tell me what I was getting or why I was, like, really getting it. For that matter, like, what was, like you said, an absence. But he didn't say what it was. He said, look, this, like, confused. That didn't make sense. 5 days and nothing, like 6 fucking bills. So here, let's rate you. Okay, I'll give you amoxicillin and take that for take 500 milligrams 4 times a day for 5 days. And if that doesn't work, come back and see. That's so right on. Buenísimo. Juliana! Buenísimo. Weekend. My channel's not for everyone. I'm fighting up against the system. And if you don't understand that it tries, that this shit travels through your waves, my channel's not for you. This is exactly why people have gum disease. Because you're not being treated properly. Why would you treat someone properly if their illnesses and pain was your income? You might not actually understand me, but feel the fucking energy behind it. And like I said, my channel's not for everyone. And if anybody wants to, oh, well, love and light, love and light. My channel's not for you if you don't fucking understand what love and light is. They're always saying about common sense, but there's no common sense in anything that they fucking do. Only for their pocketbook, and then that's the common sense to it. Well, just keep them coming back. So on the 25th last month was when I had the appointment. I took the antibiotics, but I still am having the problem. I even called, like, when you look up for walk-in clinics. Okay, I even had a woman when I said about with regards to walk-in clinics, like somebody commented on that post and said, "You're so you're psychopath, and you're in denial and manipulated by the fucking system." Because I am a psychic empath. So thank you for that, for actually recognizing it. But see, you see it as a mental health issue. Discreto, positivo é. So it's like saying about the walk-in clinic. Like I contacted them. I went on, and you go in to like do the booking, and like you have to book a time, book an appointment. They give you 2 hours in a day. Walk-in clinic. So these people, the one that like said it told me about the walking clinic, they said that they do like patients like you're in there 5, 10 minutes. Do you know that they get $28 for 5 minutes for a phone call? Make an appointment, but some days you don't even get that phone call because I've seen it happen. Or you're sitting around waiting for your phone to fucking ring because you're left on hold because you're overbooking and double booking. So with the walk-in clinic, you know, I messaged. I even have the email of them confirming that they got my email because it said like specify a time that you would like to come in, and they're to get back to you. That was 2 days ago. Yesterday, first thing in the morning, when they opened up, I called. I got the answer machine. Like I left a message to get an appointment. No phone call, but they say that they'll call you back. But the one that told me about going to the walk-in clinic, she said, "Oh, they don't call you back." But on their answer machine, they say that they will call you back. So I looked on their website today, and it said open, closes at 6 p.m. But when I went there on the sign, it said that it was open from 9 to 11. See, people wonder why there's such a backup in the emergency department. It's because you think it's logical and common and like very logical to have family doctors. There's no doctors for anyone else because they all want to be a family doctor. So you got no walk-in clinics because all of them want to be a family doctor. Why? Because they get more as a family doctor. So because you can't get in to see a doctor for something, you just need to go in and get like something quickly checked or what have you. You're all sitting in the emergency department. And then, people who really need it, it's backed up. But you think common sense and logic is to have family doctors? No, they should do away with all the family doctors. They already have your records on the computer. Punch in your name, punch in your health card number. It's there. They can bring it up. They've been doing it for quite some fucking time. Why do you think you gotta, like, really, why do you think you have to renew your health cards? But the common sense theory, the ones that are always screaming about common sense, has none themselves. Am I insulting you? You take it, it's only an insult if you're one of those people. So I never got to get into a walk-in clinic. So I went from there and I went over to the dentist where my appointment was for the 30th to get a but I went in and told them like, hey, I have an abscess. I have an infection. So I go the first of next week, which, the first thing you should be doing with someone is checking for an infection because that's where a lot of cavities actually stem from. But they'll say, oh, it's really sugar. That has to do with it. But it usually originally stems from an infection that goes untreated, and the bacteria and the infection is symptomatic. That's why it's like it's a food sign. See, people don't question their health care. They just believe blindly. And then when somebody someone like myself comes forward and, you know, brings a whole other perspective and enlightenment, you want to shit on me. Oh, you don't have nothing. You're not a doctor. Obviously, they're not much of one either, as I say. You know, I thought, you know, the Cracker Jack boss, they stopped giving licenses open long ago. Am I insulting them? Well, if the shoe fits, because like I said, they're not all the same. And the bad ones are what gives the good ones a bad rep. That's the part of, you know, the only way you're going to wean out is if you speak up about it, but nobody wants to speak up about it because they fear, oh, I might lose my doctor. Legally speaking, you shouldn't be allowed to lose your doctor because in most cases, it's not the patient breaching, it's the doctors who are in breach, but they're protected. Most of your healthcare money goes into a fund to pay lawyer fees for doctors who committed medical malpractice. There was a doctor in Nova Scotia who did an article in the Chronicle Herald, which, you know, maybe they probably tried to review that because, you know, it's spoken the truth. I think it was Dr. Robert Miller, maybe. Not totally sure, but it was Robert. Oh, he brought a whole lot of stuff forward in the Chronicle Herald. But, you know, they like to remove things from their timeline. You know, why do you think that you can't? I know somebody who they had a near death experience because the doctors weren't listening to him, and he damn near died because of oh, fuck, what's it called? Kidney stones. Thank you. Yes, I did hear you. Thank you. They tried fighting, but they couldn't afford to because not only do the doctors have a medical insurance that will cover their legal fees, the government also gives them funding to back them up, which makes no sense. And that just, you know, tells you the spin on your government has a hand in it. You're not too turning me out. Come on, don't you see like that? It's the way I fiquei a polícia mãe. Красоты. Think I don't know how I look. Maybe I don't have my glasses on, but I can sure the fuck feel how I look. I don't have to see it. I can feel it. And if looks could kill, those people fucking people over would be in a whole lot of fucking heap of trouble. But see, the thing is, what they've done to the people, it's going to come back. It's that part of you can learn what you can't hide. Ganito po rin. See, you think of your computers. Okay, it's like it's a form of consciousness. But many people, like there are people who can manipulate electronics, and I'm up against one of them right now. They like to manipulate. I can feel that right at me right now. What is he doing? Go watch The Good Omen when Crawley. It has a Crawley on it, and it has that they're traveling through your electronics. The Christ, the Antichrist, the virus, the antivirus. Do you know what the antivirus is? It's the part of the one that goes in and affects the system that has been corrupted by the virus. You speaking out puts the virus in the spotlight. The unseen becomes seen because you spoke up about it. You want the system to change, but you sit back and say nothing about what's wrong with it. And then when somebody else talks about it, oh, I don't want to hear it. Well, then don't fucking complain about it. You only want to complain about it, but you don't want to hear when somebody is putting it in the light for you to actually see the problem. You know the problem is that you don't speak up about it. Like I said, for fear. They're creating fear in you so that you don't speak up about it because they're afraid of what you will accomplish if you do speak up about it. Well, I'm going to Bolivia. Like, fuck. Do you think this doesn't hurt my body? Do you think it doesn't hurt my fucking head when it's fucking shaking? It's like getting the fucking shit kicked out of me. Except it doesn't hit just outside. It fucking hits internally. You still don't get it, do you? Felicito por quem monta é. The system does. But it manipulates you into thinking that, oh, she's just fucking the I'm right out there. Yeah, I am. I'm the only space. Disico por aqui tá nisso, porém. Eu chorei. Por isso all you do is holler at people. And all you do is fucking whine and do nothing about it. I don't mean about what I'm hollering to you or getting frustrated with you about. You want the system to change, you want change, but you don't want to do what it takes for change to come about because it may cause you some discomfort. fucking change and healing does. Go back to your denial. For a while, truth, common sense, and logic is calling. Sometimes logic doesn't come right, because you can see logic from different perspectives. It's what makes sense. Am I telling you you're stupid? No. I'm saying you're fucking smarter than that. And like I said, my channel is not for everyone, especially the ones who are not ready to hear the truth or look at themselves and the parts of the system that keeps them feeling and being the way they are with, some people, you're happy with being on you because you get attention. Why do you want attention like that? Oh, poor little Susie, she stubbed her toe. Meanwhile, there are people out there that actually have massive amounts of pain. Many things wrong. There are people out there that are worse off than you, and they're still going through life, and you're not saying a fucking word about it. Maybe they've said things to people, and it was like going on deaf ears, like nobody cared. And those are the ones that end up giving up on themselves. And those are the ones I went and watched one video where a woman had Lyme disease, and she was in pain, and another one told her, hey, why don't you go sign up for MAID? Seriously? Why don't the doctors do the fucking job? Because they don't do the proper therapy for Lyme disease or mercury poisoning, because light therapy goes a long way. Talk therapy. Talk therapy for Lyme disease? What, you're going to talk, like, to talk with a pain? Sit there when they're saying that they're in excruciating pains and they're experiencing stuff like that and say, oh, how's that make you feel? This is what the medical part says. The main treatment for Lyme disease is antibiotics administered orally for early stages or conversely for more severe cases. Other therapies may include anti-inflammatory medicine for joint pain, talk therapy for mental health, and lifestyle support for exercise and nutrition. I thought antibiotics was used for infections and the same like Lyme disease. I'm questioning. Okay, now see, things go, as I said before, things go hand in hand. Sometimes you need the medication, unless like natural remedies. But the pharmaceutical company will say, "Oh, well, that's not what. No, no, you can't tell that. Fuck yourself." Light therapy, specifically red and near infrared light therapy, or photobiomedulation. It's not a cure for Lyme disease itself, but it is used as a complementary therapy to help manage its symptoms, such as pain, inflammation, and fatigue. Standard treatment for the bacterial infection is the course of antibiotics. Okay, I don't know how long this woman had Lyme disease. Okay, start light there. I messaged her, or I gave her a YouTube video that she could go to and listen. It's the Lyme disease frequencies. The frequencies is what healed me. Listening to the frequencies and going and sitting out in nature and bringing forward all my own pain, just spitting it out. All the things that I experienced and all the things that I did from this life and previous life, it was just all coming out. It's like bringing out the poison, like therapy. You know, medical this, they don't want to put that in there because it's a cheap way. You should like even the vitamins. That too is a money grab because you're actually supposed to be you actually all your foods actually have those vitamins in it, but they make those foods so fucking expensive so that they can profit from you going and getting these pills. And you don't even know if each pill has the same amount of stuff in it. So with regards to health, both what's perceived to be health industry with the synthetic, the pit, the pills, and then going to the medical system, it's still a pill. So when we go back here, Parece como ele. Well, ain't that weird? Okay, so adjunction therapies, right? Because we went through the antibiotics, anti-inflammatory medicine may be prescribed to manage pain from Lyme arthritis, but a lot of medication also has side effects. So you're putting more side effects on more side effects. So how's that actually happen to the patient when okay, anti-inflammatory medicines, light there? Oh, wrong one. Oh yeah, okay. Light therapy is not a standalone cure for Lyme disease, which requires antibiotics treatment. However, red and near infrared light therapy, photobiomodulation, is used as a complementary approach by some patients and clinics to help manage persistent symptoms like chronic pain, inflammation, and fatigue. So that's something that you could use without taking the anti-inflammatory drugs, which actually can create an ulcer in your stomach, which creates more pain and suffering, right? Common sense. Let's go back. Talk therapy can be a valuable tool to help manage mental and emotional health changes that may arise from the chronic illness. If you did, you know, if you actually didn't create so many problems for the people, then they wouldn't need the talk therapy for it. Like I said, you could get light therapy for, oh, where was it? For chronic pain, inflammation, and fatigue. How light therapy is used for symptom management. Light therapy, specifically red and near infrared light, works on a cellular level to promote the body's natural healing process. A cellular level. Everything happens on a cellular level, even within your bloodstream. Oh, damn it. Well, I don't have to be a doctor to know that. Gonna shit yourself? Risiko boy. My channel's not for everyone. I'm telling you right now. It may help manage Lyme disease symptoms by reducing inflammation. It has been shown, you know, it has been shown to decrease inflammatory markers and can be particularly beneficial for joint swelling and pain associated with joint arthritis. Elevating pain and discomfort. Let's see what they tell you about pain. Oh, that says manage pain from Lyme arthritis. Anti-inflammatory medicine. Okay, so let's keep going. So there's nothing about like they just say exercise and change your diaper, change your your diaper, change your diet. But you're unwell. You're in pain. Go take some ibuprofen. Go create an ulcer in your belly and hold because you cause Alzheimer's. It's a nut. A whole lot of symptoms. Elevating pain and discomfort by enhancing blood flow and tissue repair. It repairs to repair tissue. It can help reduce chronic muscle injury. So light therapy alone without medication, except for your antibiotics. And then they only put you on that for so long. So then you can take light therapy instead of taking a pill like you separate cover. It's what you're used to. And what you're the only alternative, the only thing you're told will work. Why don't they implement this in every fucking doctor's office? This stuff be the first go-to. And I'm not saying that there's not other medications that, could be faster. But you're not supposed to be on medication your whole life. Because if you're on medication your whole life, you're not doing your job. Because you're not finding out what's causing the underlying symptoms or the underlying problem. Whether it be physically, mentally, emotionally, spiritually, or energetically. Improving energy and function. The light stimulates. That's why, like, I have my lights on when there's no light outside and it's really dreary or the sun's not out. I like to have my lights on because it's a light therapy. But turn the lights on, man, and you might fucking start healing. Afraid you might see your own shadow. Can't see the shadow in the dark, right? Unless you got a light on. Improving energy and function. The light stimulates the mitochondria, mitochondria, the powerhouse of cells. Sound, light, frequency. You can hear those long tube bulbs. You hear that really like aggravating sound. Most people you can't hear it, but it's that numbing, and that's what keeps you just like constant heat. That's the wrong type of light. It's sending off the wrong frequency. And that's why children and adults and what have you, people with autism or ADHD or ADHD, that feel like they're being fucking insane because those frequencies are pulling them all over the place and they can't get them brought together. But you know, the ones in charge of the system know that. That's part of the mind control. Like, oh, you're fucking left to mind. You're crazy because all this mind control. How often are we not on our electronics? You know, where was it in Australia? I believe I was watching something, and in Australia they're putting an age restriction on children that can go on to social media. You know, phones shouldn't even be allowed in school because the order of the kid. Why? Because you say about what's happening in the school. You know, how about you just make a surprise visit? Wouldn't that make a whole lot more sense? People don't want cameras, but in all honesty, maybe the classrooms are where they do need some form of surveillance if you're so fucking worried about what's going on in the classroom. But that may be too much common sense. No, phones should not be in the classroom. And should they be teaching the way they're teaching? Fuck no. You're teaching a program. You're not even teaching your math right, or your history, or your science. You're not teaching it properly. How about you teach hands-on, show them how it's done, and what's with all the putting in theory and stuff like that? Like I say, why? So you can sound intelligent. Sorry, but people who have ADHD and ADD and autism, they don't seem really to be intelligent in that sense, as it's you talk too much and there's too much bullcrap in between. You can get right straight to the point and save us all some time. Stupid powerhouse of cells to produce more energy. Why do you think they tell you to get vitamin D? The sun, not the synthetic pills, but the actual sun. They keep changing. You got your time change twice a year. It's to fuck with your system because the sun is the ultimate light therapy. But they put so much fucking chemicals in you that actually counteracts the actual effects of what the sun is meant to do as a natural cure. But they tell you it actually hurts your skin. No, the sun itself isn't what hurts your skin. It's the chemicals that they're putting in your body. They make the sun an enemy when the sun is you know, sun, the mother birthed the sun. Healer, do you get it yet? They make you believe it's a man, but the man is actually talking about the sun itself. And the rain is what plants the water. Everything is water. Why do you think they say you have humidity? What's humidity? Humidity is fucking water. Everything goes through your water, your vapors. いすきもとけしと por equitie. Correte. Correte to simo. To produce more energy, which can combat fatigue and brain fog. How many people are saying, how many people, like, seriously, putting the Lyme disease aside because, the brain fog works for everyone, right? So you're like, that should be readily available, especially in the hospitals. Maybe that's what should be in the hospitals when people are waiting. Because you ever go in a waiting room and you walk into a hospital doctor's office and you always feel worse off than what you did when you first went in. Do you actually know what that's caused from? The light and the frequency going through the room and the feng shui, the way it's laid out because it's bouncing. There's no flow. The lights they have in there is constant. Everybody is like, you go to that just a doctor, you go into a hospital, they have like it's just so fucking damn like it's blinding and it's just the sound not only from the frequency, but all the sounds of the beeping and everything like that going off and what have you. A hospital, you say, is a place of healing, but a hospital in many cases actually creates more mental health and more illness than if you just stayed at home and treated yourself or had someone stay. They took out the little hospitals, which was actually more conducive. Mental health. If you're being sent to a psychiatric unit for mental health, it shouldn't be in a hospital in that type of setting. It should be in a place where it's more relaxing. But you say, "Oh well, people will destroy." No, I've been in the mental health institution a few times, and there were very to little amount of people that were going around and fucking destroying everything. Most of them were sitting in front of a fucking TV, either in the YouTube room or in the room where you could watch the sports and news and all that shit. And then a little chessboard or a checkerboard and some colored pencils and crayons and a coloring book. How is that conducive to mental health or health period? People, most people can't sleep in a hospital. They don't get very good rest in a hospital because there's always noise. And they're always coming in and waking you up every 4 hours. Oh, time to take your pill. Don't let them say it too fucking bad. Then my channel's not for you. I must speak too much common sense and people don't like it. They like to say about it. Brain fog, often associated with chronic Lyme disease. Brain fog creates the mental health. So something that could cover many things, they want you going and taking different things to counteract the symptoms that can be accomplished by light therapy. And right there, it just sounded like somebody just got an ounce because I heard screaming tigers. Boosting the immune system. You have Lyme disease, so you're more susceptible to getting pneumonia too, because the immune system is too weak to fight it. But this light therapy helps. Boosting the immune system, improve the circulation and cellular function can enhance the immune system's ability to fight off infections and support overall health. Aiding detoxification. Oh, don't say that. That's not gonna work. Are you sure about that? I've been taking oh shit, Medications Earth. I mean, no, I probably didn't pronounce it. Oh, shit. Fuck, what's it called? It's right there on my tongue. Dimetacious Earth. Um, I use that. I take like a tablespoon in my coffee. They recommend that, if you take it, you do not take too much time to do it. But I use Dimetacious Earth in this thing called black tea, and I put the Dimetacious Earth in it too. And it actually works. Some say fasting. So Dimetacious Earth. Aiding detoxification. Infralight, often used in saunas, can help the body flush out detox or toxins through pre-separate precipitation, reducing the burden of liver and kidneys. Like I was going to the sauna sometimes at where the gym is. Sauna, and I was going to sit in the sauna, and it just sweats. And oh, that's maybe that's what Spirit's doing with me too. That's why I'm always sweating, is because my body is it's pushing out all the toxins. So now I know that my mom would sweat all the time. She was putting so many toxins in her body that her body was trying to get rid of it because she was constantly sweating. Maybe you're not going through menopause. Maybe your body is getting rid of toxins in your body. And certain things you keep putting in, so your body continues to try to get rid of it. And right now, where my body is sweating so much, it's trying to get rid of the infection. I go to a doctor when I feel like, okay, I need to go to a doctor. But I don't just run to the doctor for anything. Like that. This has been going on for like a few years, more than a few, because it would have been going on since the doctor pulled that tooth back there back in '99. So, yeah. I was on an antibiotic because I had a cystosis in the bladder. And that was created by me getting a bladder mesh. You know, if you're getting a mesh of any kind, you want them to use your own body tissue because they can. But your body tissue doesn't cost anything, and these meshes do. Oh, burn! Just saying, I was part of a class action lawsuit with regards to one of those meshes. I'll never buy the baby oil again or anything of their products. Okay? So taking these pills for the cystosis that it created, like it was closing off my urethra. I would have 7 milliliters of fluid in my like urine in my body. And when I go to the bathroom, there'd still be like about say measurable. And then when I go to the bathroom, there'd still be between 300 and 400 liters remaining. So it was causing me to be extremely unwell. And then on top of taking these pills, well, they weren't, they were just creating more problems because my internal organs were hurting all the time. And I felt ill, like I was always going to throw up. And I was losing my hair. Well, they never introduced me to that. They just poo-pooed me on the mercury poisoning. I got mercury poisoning in 2008. In 2009, I went from 184 and dropped down to 94 pounds in less than 4 months. I couldn't hold anything in. I was sweating, or if I wasn't throwing up, I was gag reflexing like I was going to throw up. And the only thing I could hold down was Mr. Noodles, and then that would still come up. And people would say, "Oh, well, you were anorexic or bulimia." No, it was caused from them not hearing me with regards to the mercury poisoning because they think they're so fucking intelligent. And nobody knows nothing. People don't know their own body. You're fucking right. People know their own body. Doctors are too ignorant to fucking listen to them. I got the certificate, not you. Like I said, I thought the Cracker Jack box stopped giving licenses a long time ago. Important considerations: complementary versus cultural. Light therapy addresses symptoms and supports the body's healing, but it does not directly kill the Ebola bacteria that causes Lyme disease. Well, that's where you have antibiotics, but it alleviates the you know anti-inflammatories, ibuprofen, Advil, naproxen, what have you, and painkillers like your hydromorphone and Tylenol free and Dilaudid and all that creates an addiction. Antibiotics remain the standard primary treatment for the infection itself. Implement light therapy, frequency healing, and you know, using things to detox your foods that detox your body. Emerging research. While studies show promise for treating various conditions and symptoms, more large-scale, high-quality clinical research is needed. It's a matter of changing the frequency of the light of the room, because you change the frequency, you change the frequency of your body, your blood heals. The four elements: physically, mentally, emotionally, and spiritually. Physically, mentally, emotionally, and spiritually. Okay? And then it all cleans up energetically. High quality clinical research is needed to determine full effectiveness, specifically for Lyme disease. Much of the current evidence is anecdotal. Well, hey, instead of doing all these fucking trials on synthetic pills, why not do the trials using the light therapy? Cheaper and make more sense, right? But it's not good. You know, I'm going to say this was like that, but what I'm speaking of is much of it what said. Light frequency. I know he was talking to different people. MRIs, CT scans, they're not even done right because you don't need to do that banging and clanging. Just a light frequency will make it shift. It doesn't have to deafen you. It doesn't have to create a pain in your head because of the sound. Shit. It's almost like being in a fucking grant all day where like they got everything, all these fucking loud noises going in. It's being on a ship. You know, things don't have to have like the moon, they don't have to have all that sound. They don't have to have all that whining. Have you ever heard when the electric vehicles backing up? It has one hell of a awful fucking whine. You know, I'd say that and try to shut me. It's like the door shuts. I don't hear you. I carry on. The noise. You shut it. It was like almost like a professional guidance in essential. Always consult a physician or a Lyme literate medical doctor before starting light therapy or any new treatment regimen. They can determine if it is appropriate for your specific case. Okay, let me tell you something. Light therapy is not going to cause you harm. It's light. There's nothing you're interested in. There's nothing you're inserting in your body. Nothing going on your body. You're sitting in light. You're in a sauna and you're sweating. Do you know there are medications that say that you can't eat specific vegetables or use specific herbs because they will counteract on that healthy stuff? Don't you see the fucking problem with that? I know I got away from the dentist part, but it's all in the same. It's the infection. And you don't treat it. You just exacerbate it by creating more fucking problems. Qu'est-ce que But you know, it's not just the system itself, it's the people. Because we don't hear common sense because we're programmed to think of synthetic. You know, that's the AI, the synthetic, right? Say fake food, that's synthetic, which, you know, you put pills, but you say fake food. She's a politician and she makes her own mattress. Like that. But I didn't like the fact that when I went around and talked to people during election time 5 years ago, 5 or 6 years, I asked her if they're like volunteering for something. So she asked me if I wanted to be in charge of books, but I wouldn't be the one keeping the books. I would just be the one signing. So would I buy her products? Not after that, because if you're capable of doing that, which is the worst thing, one of the worst things you can do, because you tried to take advantage of somebody who was real that you knew, someone who was on a disability from a brain injury, and you knew that. So she tried to take advantage. So no, I didn't buy it. Just like, and then I both did it because you're quicker to think. Back in, it's like 2000, 2000, with one politician who's like, it was he helped me get more assistance so that I could keep my apartment for my son to come see me because I had lost custody because I used a Ouija board and ended up in the psychiatric unit. And strangely, during court, it was actually a big time conflict of interest because when I lost custody, my son's teacher was the wife of my ex-husband, of my son's father's, or of my son's wait, my son's teacher's husband was my son's father's lawyer. And the teacher said not so nice things about me, saying that my son always went to school soiled and unfed when he was always fed and clean. And I had been going to the school and asking them, like, have you been seeing any changes in my son? Oh, no, no, no. But yet, anything to keep your husband afloat, right? And now he's partner of a law firm. To him and his wife, how many people did you fuck over to get that? That's like an infection. They're the infection and the virus. So no, I will not. I'm not going to show the system any respect. I'll show respect to the ones in the system that deserve the respect. So when I look at this stuff and what I experienced with regards to my tooth and him saying, "Well, or pulling it," even before he gets rid of the infection that's been traveling through my body for quite some time. Yeah, no wonder Spirit damn near fucking jumped right out of the chair. You know, just because it's say, look into it yourself, please. I'm not saying that they don't always know, but if, like, you know, they don't want you to question things for a reason because you might catch on. Se tu parece número segredo. Because I can feel that spirit. My channel is a spirit to spirit. So if you're experiencing anything from what you're observing, whether you're getting pissed off or you're throwing understanding or you're throwing what have you, it's because your spirit is connected to the spirits that are expressing this. I tell you, it's spirit. Everything is spirit to spirit. Why do you think? Why do you like say like the light coming back to the light? The light is therapeutic. The truth is what they're talking about with regards to the sun. That's why people perceive that they're putting in a fake sun. Well, a fake sun, would that not be the Antichrist as you perceive? Or is it that they say that Venus, is it that Venus and the sun are coming together? Are you saying the sun is fake, or are you saying Venus is fake? How many of you have seen the eclipse? I actually have a video. Sorry, just give me 1 second. Can I see more? How far back is it? Here comes the sun. Here comes the Ah, thank you. Okay. Esse mostra ele no recibo. Okay. Pues sí que no. Okay. Now, I'm going to show you this video. It was the video that I took of the eclipse, and I don't recommend, but I stared right into it and I watched the whole thing, and I recorded it with my phone, and I didn't have to go to system. I said, "Oh, you feel good." Hey, am I? Or is your perception? Because it's all the chemicals and everything that you're putting in your body, stuff in your eyes, it's creating even frequency will create a brain fog. No, he's right there. Vitamin D. The light sends off. The sun doesn't send off almost completely infrared. Here comes the sun. Here comes the sun. I say it's alright. Oh shit! Hold on. Excuse me. Okay. Where were you when the lights went out? We were all in the dark. Where were you? Okay. So. Okay. This is as close as I can get it. I hope you all can see it. This was the eclipse 2024. Do you see that light coming up in there? Right here? That's Venus. The people that were watching the eclipse around us, one of their husbands looked up, and that's what it was. Is Venus the sun? So maybe I should just leave it like this. This actually Like in my YouTube, it's not very great. This is a good one. Okay. So how many of you watched Fifth Element? Okay. She gets out of a healing pool. And then at the end of the movie, they put her and Bruce Willis into the healing pool. And where they take her to the pyramid. Love is the element. Love is the fifth element. Earth, wind, water, fire. Physically, mentally, emotionally, spiritually. Earth is physical. Wind. Earth. Okay. Earth. Water is a river. It's emotion. Wind is the mental because everything spirals. And fire is the spiritual, which is the truth. And yes, sort of animal. It's like we're looking for answers, but we're not allowing ourselves to see because we figure that the answer is supposed to be certain. I'm glad that you know, that spirit told me to question because I could have been in a whole lot more trouble. Now, for the medication, the antibiotics that the dentist put me on, okay, I did a calculation of the difference of milligrams. Okay? This is really fucked. And doctor was like, he should be looked into, this dentist. We'll review. This was the prescription I was given for an abscess tooth that was right into the nerve and getting in for the roots. He said it was all in there. All in there, yeah. So, first day I took 2 pills. 1 pill every day after. Okay. So for 5 days, I took 1,500 milligrams. And that was on the erythromycin. Okay. That's 1,500 milligrams. Now I went down to oral cephalosporin, CEPHALEXIN, which is 500 milligrams 4 times a day for 3 to 7 days. Okay. So I calculated it up for taking it the whole week. The other was for 5 days. And that was 5 days worth of medication for a really bad abscess infection that wasn't drained or cleaned. Now, for the 500 milligram, 4 times a day, that's 2,000 milligrams a day. Per day, that's a difference of 1,150 milligrams. So you take that for 7 days. That's 14,000 milligrams of an antibiotic for 7 days. And that dentist gave me 1,500 milligrams for 5 days. And that was supposed to get rid of a really bad infection that's been there for quite some time. That to me would, that would be the lowest floor of symptoms. So where exactly did you get your license from? Because I thought, like I said, I thought that they stopped giving license away in the Cracker Jack boxes a long fucking time. I didn't even think that you'd be old enough. When did they stop? Hold on. Oh, they probably still have the Cracker Jack boxes, do they? They have not stopped making Cracker Jacks. The brand is still in production by Frito-Lay. However, in 2016, the physical toy prize was replaced with a GRO code for a basketball themed game. More recently, some boxes contained a sticker to unlock online games according to Cracker Jack something or other. Watch this. When I put in, when did they stop putting licenses in Cracker Jack box? So they're saying the licenses are toys because they come out Cracker Jacks stopped including physical toys. You know, you don't have to like agree with my opinions. You don't have to agree with what I say or what I bring forward or how I see things from a different perspective or how I see them from a common sense. And from the side of, your doctors should not be offended. What, like, I question whether or not he wanted to do that because he was frustrated because, maybe the nurse went back and told, and I even told him, like, I'm not real fond of dentists and that because of experiences that I had. I even said about like, some places like not around here, but some places actually use frequency in a dentist office. So what, like, did he get offended? Was it some sort of a thing like a punishment? How dare you question what we do? Considering back years ago, it was cobblers who worked on people's teeth. I almost think I would trust a cobbler because at least they'd be honest of, this is going to fucking hurt. Or, hey, it was cobblers that used to make, that used to do the dental work. Sounds stupid. Instead of telling somebody something sounds stupid or that they're stupid, why don't you look for it yourself? You might learn something. Or, you might prove me wrong, but I may prove you wrong. But will you admit to it? At least I will. Today I was in the truck, my ex-husband, and he asked me to check the like look at the weather, check the weather. So I checked the weather, and I told him what the weather was saying, but somehow I was wrong. Well, that's not what it says. Oh, that's not what mine said. Well, like that's what mine's saying, but somehow I was wrong. When at the end of it all, he found out that I was right. But it's very difficult for people like that to admit when somebody else is right and they're wrong. I had somebody say to me, like, oh, poor little Tara, poor little dude, with, poor little Tara, the fucking shit that I put up with. No, it's not poor little Tara. And that person knows who I'm talking to. That spirit knows who I'm talking to. Because if they think that I don't know that they do watch some of my stuff, whether they watch it all or they just like, come in every so often and then hear something and run with the rest of it, leaving it to their own mind or opinion, instead of actually getting what I'm saying and the point that I'm making in order for people to hear. Because I'll tell you right now, I'm getting really sick and tired of being told that I'm a stupid idiot. I'm going to take those words and shove them up their fucking asshole. Seriously, if I'm stupid, you must be just as stupid, if not stupider. But just say you're intelligent because everybody else is always wrong. So I know what spirit I'm talking to. I know who you are, and I know which people you are. Because spirit always likes to duplicate it. Figures, sometimes it figures it's not seen. But that day that I was in the dentist, I seen everything that was going on. And I could hear the mind chatter and the telepathy going on in the way. But people say, oh, yeah, nothing. Okay. You call it a paranoia, you call it a schizophrenia, but hey, I call it spirit. And I connect with yours. People say, oh, you have to have someone's permission. No, actually, God gives me the permission because it's God connecting to it through me and through you. It's like, if I'm experiencing you, it's because, hey, don't want me experiencing you or your energy, then, learn how to control it yourself. Seriously, I'm not shitting you. It's a part of you have your energy opened up, but like, it's like I connect with your emotions, whether they're angry or happy or sad. I have to hear you talk. You don't have to look me in the eye. It's energetic, right? Thank you. I'll tell you. You think you're a skinwalker. Isso é luxo, então. Via que eu tô por ele. He's my best friend. He comes to me when I cry. He fights with me sometimes. It's like he gets overstimulated. We think, he's ADHD, he's autistic. If you think animals can't be, well, they see things on a different plane, don't they? So if they see it, then that means you are able to, but you say it's not a gift. You just have to understand. Because you be able to help yourself and you be able to help others. So many kids. So I question because I question through energy on the whole environment at that dentist office was telling me something ain't right here. And Spirit was telling me right. Energy, I was reading it right. Everything just seemed weird. Eye contact. Everything was just. I know things switch. I see faces change up. Like there's look like the same person, but their face actually changes. So I'm gonna be high trustworthy in my body, my energy, my spirit will tell me to trust and not to. And sometimes you can trust the people that you don't trust. But more often than not, those are the ones that we do. That's the awareness. Being aware when your body is telling you something's not right, it's like then you're aware. That's because you're aware. You're not only aware of yourself, but your body's telling you something's not right because you're aware of your strength and you're experiencing it. That's why it was like when you said about pulling the tooth today. It was like I damn near jumped right out of the chair. Like, no. And then my ex-husband, he tried to convince me. It's like, yeah, no, why are you trying so hard to convince me? Like, this will cause more of a problem for me because you have to clean up the infection first. I don't even like trust my ex-husband. It's not a paranoia either. It's just you give me reasons not to. You know, like there's a little bit of, but there's walking into things blindly with the blinders over your eyes and not seeing the truth of what you need to be seeing. That would have created more problems for me than me just suffering with the pain right now and waiting to get the appropriate treatment. At least right now, the infection's moving slow, but the other way, it probably would have just sped up. But he didn't even drain the abscess. He just pushed on my gums and said that he had to give me a root canal in my tooth because the x-ray showed a cavity going in. And I said, like, I think I had a filling in there before and it fell out. And I said that, when I got a filling, I wanted the clear stuff. And I was like, oh, well, give what the doctor thinks is right. Clear stuff should always be the right stuff instead of putting fucking metal in people's mouths. Do you know the metal, the stuff from my other fillings is fucking leaching into me? And that's also part of what's making me ill because it's leaching. Metal's not meant to be in your mouth. If you ever take a piece of tin foil and bite down on one of those silver fillings, oh, it'll fucking make you cringe. You put metal in your body, and how much, like, people that have metal in their body, like for replacements or like whatever, like your bones or what have you, metal plates, things like that. How much pain do you, when that stuff starts, like, as it's like a decay, it starts to leach over time. But let's say it doesn't. You know, they tell you fluoride. They put fluoride on your teeth. Okay. They put fluoride in your water. They put fluoride in your toothpaste. What else they put fluoride in? Okay. What do you ingest most? Water, and then you every day you're putting the fluoride on your gums, right? You're brushing your teeth, so you're brushing your gums, so it's reaching in. Open wounds. So I asked, what happens if you ingest fluoride? Think of it this way, every time you drink water, like every time you drink, you're drinking fluoride. Every time you brush your teeth, you're putting fluoride in your mouth, in the saliva, open wounds. Ingesting fluoride generally has no adverse effect in small recommended amounts. However, consuming excessive amounts can cause a range of symptoms from mild gastrointestinal upset to serious health conditions, depending on the quality ingested and the duration of exposure. You're drinking it, you're putting it in your toothpaste, what have you. Okay? Acute ingestions, large single doses. If a large quantity of fluoride is swallowed at once, a child eating a large amount of fluoridated toothpaste or an accidental ingestion of an insecticide, symptoms usually appear within minutes. How many of you as a child would go grab the toothpaste bottle or tube and eat the toothpaste? They make toothpaste flavored for children. Common symptoms: nausea, vomiting, abdominal pain, diarrhea, and a salty, soapy taste in the mouth. Severe symptoms. In extreme cases, high doses can lead to muscle weakness, tremors, excessive salivation, 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 spitting, saliva, seizures, and electrolyte imbalances, low calcium, high potassium. Sound familiar? How many of you are suffering from that? You're drinking water all the time, right? But they tell you it's for your health. No, it's for their profitable gain through the healthcare system. So it's not for your health. It's to increase their profit. Life-threatening cases in rare, very high doses ingested, 5 to 10 milligrams in adults. I'm live. So, life-threatening cases in rare, very high doses ingestions, 5 to 10 grams in adults. It can lead to respiratory, paralysis, cardiac, arrhythmias, and even death. Now, I have a tablespoon here, 15 milliliters, and I have a teaspoon here, 5 milliliters. And I asked how many grams in a milliliter. There is no single answer for how many grams are in a milliliter because grams measure mass and millimeters measure volume. The conversion depends on the density of the substance. For water, 1 milliliter is equal to 1 gram because of its density. That's poisoning because 1 milliliter is 1 gram in water. So if you're drinking water and it says 5 to 10 milliliters or 5 to 10 grams, so in water, 1 milliliter is equal to 1 gram. So let's see, 5 milliliters would be 5 grams. So roughly anywhere from a teaspoon to 2 teaspoons. They're saying life-threatening cases in rare, very high doses ingested, 5 to 10 grams, which would be the equivalent to roughly 2 teaspoons. Ugh. Ugh. Two teaspoons. Would you like your water now? So, the fluoride they put in your water goes to every house. That's hooked up to the system, right? That's classed as life-threatening cases, and they say in rare. Very high doses ingested. That's the high dose because it says 5 to 10 grams, which I just read to you. 5 to 10, like 1 gram is equal to 1 milliliter in form of oil. In adults, someone like myself here, I'm on a well. It can lead to respiratory paralysis, chronic arrhythmias, and even death. So you just think, oh shit. Son of a bitch. Who shook that up? Who bubbled up the nose? You watch me pour this. Here's 1 teaspoon. Shit ass. Oh crap. Not very good at that. One, two. And I'm making an awful freaking mess here. No, I'm putting in color so you can actually see. There. That's the amount that they're talking about fluoride that can be life-threatening. And you're drinking it in your water. You're putting it in your mouth through your toothpaste. And sometimes your mouthwash or other things, what have you. But just that amount is considered to be life-threatening. And you're drinking it all the time. You're putting it in your mouth. Excuse me. Two teaspoons. That's all it takes, it's saying. But it says in rare, very high doses. This little amount here is considered a high dosage. And that's a fluoride. Action. If a large or unknown amount of fluoride product is ingested, contact a poison control center immediately via their online tool or by phone. You're ingesting large amounts of fluoride every day, all day, and you wonder why you're unwell. You wonder why you're having respiratory problems or cardiac problems. The system probably, try to block this because, I know that, that in my live on my TikTok, nothing's moving. So I know that, they like to stop it because I'm talking about something they don't want you to know because it affects their pocketbook. Do you ever let's see? I want to see them do the stuff that they give to people, the ones that are aware of it, of what they're doing, because there are many. And then there are the ones that have been taught by manipulation that, oh, yeah, it's good. Not, like, not telling people that that much of fluoride is considered life threatening. Chronic ingestion, excessive amounts over time. Or you're brushing your teeth every fucking day. Some people are brushing them 2 or 3 times a day, and you're drinking the water and everything else that is made from the water that you're drinking. Long-term excessive fluoride intake, typically from drinking water with naturally high levels of fluoride, can lead to two main conditions: dental fluorisis. This only affects children during the period of tooth development up to the age of 8. In cases, aesthesious damage to the teeth enamel, ranging from faint white spots on lines in middle cases to brown stains and pitting in severe cases. Mild forms do not affect tooth function. The kids are like, once your kids' teeth start growing, you start brushing. You're exposing them to the fluoride then. They're not even good yet. Chissà non potessi chitarino. Shit. Like they still doing. And then you wonder why you're like, hey, skeletal fluorosis. Says this is rare. Severe conditions result from ingesting very high levels of fluoride, which, this is considered a high level of fluoride, and you're fucking drinking it all the time in your water, and you're putting in your toothpaste. Hey, from levels of fluoride over many years, it involves the gradual hardening and stiffening of bones and joints, which can lead to chronic pain, limited mobility, bone fragility, and increased fracture risk. What the fuck's going on with people? Hey, aren't you experiencing all that? You wake up. This is the way. But we're just conspiracy theorists. It's on your Google. You like looking at your Google. Oh, right. It's only when you want to look for something to entertain, not like look to see how you can, educate yourself so that the wool pulled over your eyes. Potential neurodevelopment effects. Some studies have suggested a link between very high levels of fluoride exposure in early childhood and potential cognitive defects of or low IQ scores through evidence in populations with optimal water fluoridated levels around 7 milligram L's is considered inclusive or weak by many health experts. Who's the health experts? And is there any way they have personal gain? normal exposure when consumed in recommended trace amounts for fluoridated water, 0.7 mgL. 7 milligrams of a substance per liter of liquid. So that's 10 milligrams. Ow! 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 Shit! You can come up. Maybe it just wasn't ready for you. And you were under a table. So, oh, no, that was grams. Okay, just one sec. Oh, it did say. Sorry, it said milligrams. Thousand, 1,000 milligrams to a milliliter. Is that right? The water, 1 milliliter, is approximately 1,000 milligrams. So it's not even a milliliter because it's only 0.7 milligrams, and they're talking there's 1,000 milligrams to a milliliter, and this is this is 10 milliliters. Here's your science. So that's recommended trace. So less than this, way less than this. Not even one, not even half of this. Almost like a few drops. Is US, that's the US public health safety recommendations of the dental products used correctly. Spit out, not swallow. Putting it in your mouth is full of opened wounds. Common sense. You get a scratch, it's an open wound. Fluoride is safe and highly effective at preventing tooth decay and strengthening bones. It calcifies the bones. That's why you get joint pain. Doesn't make your teeth any better. I tell you it's okay to put it in, this here amount here to ingest alone is considered life-threatening. So now I wrote, do they use hazmat suits when working with fluoride? Yes, hazmat suits and other specialized personal protective equipment, PPE, are required when handling concentrated forms of fluoride components, such as hydrofluoric acid or sodium fluoride solutions, due to the significant health hazards they pose in high concentrations. Even baking soda could cause is what it has in it. But I was looking to see with regards to some of the shit where they're saying that I was looking for if that was in okay. Why protection here is necessary. Courses of exhibit and torture. Concentrated fluoride chemicals are highly corrosive, corrosive and toxic. I'm checking for certain things. Okay, and toxic. Hydrofluoric acid, in particular, is extremely dangerous because in fluoride ions, because the fluoride ions can perforate deep into tissue, causing severe damage and systematic toxicity, even without immediate. You're ingesting, you're showering. Exposure risk. In industrial settings like water treatment plants, where large quantities of these chemicals are stored and handled, there is a risk of spill splashes or release of hazardous gases. But you're drinking shit that causes this. Is that why your farts stink? Safety protocols. To migrate these dangerous safety regulations require the use of specific PPE, which can range from specified gloves, lab coats, and face shields to fully collapsate hazmat suits, depending on the concentration and risk of exposure. Specific situations start requiring hazmat suits. Water treatment facilities, workers adding fluoridation chemicals like hydroxide acid to water supplies must wear appropriate protective clothing. But they're putting that in the water and they're telling you to drink it. and making putting it in toothpaste and stuff that you put in your mouth because there's all different forms of the toothpaste. Gets on your gums, gets in your open mouth wounds. Your tongue is a lot of the time it's very much an open wound. Industrial accidents, those emergency response teams, fire rescue, hazmat teams use full hazmat suits when dealing with accidental spills or leaks of concentrated hydrogen fluoride or other high risk fluoride components to ensure maximum protection from gas and liquid pre- penetration. 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 High concentrated handling in laboratories or factories where high concentration of HF are used in oil refining or in dissolved rocks for analysis. Safety protocols or specialized suits are indispensable. It's important to note that the diluted fluoride ions in the fresh drinking water or in toothpaste are at safe levels and do not pose these types of hazards to consumers. The protective measures relate to handling the high concentrated sources of materials. Okay, it's still going in your water. And in order for it to do as they say, that you'll say that they're using it in your fluoride for your teeth and your bones. So in order for it to be effective, how much are they putting in there? And you're drinking it. A lot of the time, people are using it in high quantities because we're using water constantly. Hey, I start brushing my teeth with baking soda again, considering it tastes awful. But I should make it with, I have that activated charcoal. So I should take activated charcoal, baking soda, and coconut. Coconut paste. That's what needs to happen is people need to start bringing this stuff back into the light because it's not expensive to make. It just needs to be taught. See, Spirit takes me where my channel wants to go, but that's another part of going to the dentist because I brush my teeth all the time. I brush my teeth twice a day. And no, they're not going like that because I'm not using fluoride. They're going like that because I have an infection. Because I stopped using fluoride. That's the part of, we walk into things blindly and we believe, excuse me, wow. We believe that because they have a certificate or like a piece of paper that says that they know this stuff. Yes, they go to school and they learn stuff, but they don't listen to their patients. They're taught not to listen to the patient, go by protocol in the book. Somebody has this symptom, well, it's got to be this, but you don't hear the rest because you're in too much of a rush to get everybody out of the office so you can give them a prescription because most people are having that. Not being rude, just saying. Tired, excuse me. Like, doing this is a lot. I connect a lot with the ancient spirits, the ancestors. You don't have to believe in them, but don't preach to me the Bible about it if you don't understand it. Just saying. But it doesn't make things good. They keep you distracted with these things, vision and stuff like that, so that you don't see the truth of what they're actually doing to you. Don't you think if they actually want you to find purpose, they'd show you the way instead of you say they know the way? I said, my friend is a spiritual spirit. You like me, you love me, to show up and outside my head, destroy me by head. Keep your hands to yourself and put them in the deck. Guy that David from your old grandma, you don't realize how fucking well I wrote it. See, it feels like the body, the soul, the spirit. It's pretty fucking ancient. And it's more enjoyable than ancient. Que se apaga muy. They want you to look at people like myself as being crazy, put labels on us. care of the mental health because they feel spiritual. Because if they were, people wouldn't be suffering right now. People wouldn't be homeless. People wouldn't be fighting with one another over what they look like, what they do. Whether you give your God the same name as what somebody else gives him, it doesn't matter. I need to see people on here saying about all these people with this eye color, or this blood type, or this or that. Okay, it's just because they have the same blood type or different blood type, or it doesn't mean that they're like all the ones that you encounter with that. But you will say they are because you'll get your statistical say, oh well, this many people in a setting of this many people, and you got this, but like there's like 8 to 9 people. But you'll go on a test of say 1,000. You probably interviewed them first. Just saying. I used to say right, right, but now I'm just saying because it doesn't matter. But even if it was, you'd say it. So it's not much fluoride, but it's considered life threatening. They say, oh well, it's just a concentrate, not concentrate or concentrate. If you drink enough of it, ingest enough of it every day, all day, you're already experiencing the symptoms. But they're telling you it's something else. So please, wake the fuck up now. And with that being said, I'm sending you all much love, light, many blessings, most importantly, very good health to anyone and everyone wanting, willing to receive. Except, I want you all to be big, bold, brave. Most importantly, be yourself, be your authentic self. Be true to yourself, be kind to yourself, and, know your strength. And please, wake up now.